Celiac disease is a fairly common hereditary autoimmune disorder that affects approximately 1% of the population. It is a condition where gluten, a group of proteins found in wheat, rye, barley, and other crossbred grains and grain products like bread, causes the immune system to attack the surface of the small intestines of affected individuals. This adverse immune response results in damage to the villi, small surface projections of the intestinal walls that help facilitate nutrient absorption. This can cause malabsorption of nutrients, or in more severe cases, malnutrition in celiac sufferers. Celiac disease can manifest at any time following the introduction of gluten-containing foods or medicines and may not appear until adulthood. Left untreated, celiac disease can result in serious health complications.
Now let's talk about the signs and symptoms of celiac disease. Adults are much less likely to have digestive symptoms, with only 1/3 of adults experiencing symptoms such as diarrhea. Adults are much more likely to experience things such as fatigue, bone or joint pain, arthritis, osteoporosis, anxiety or depression, migraines with potential seizures, missed menstrual periods, and the possibility of infertility or recurrent miscarriages, and itchy skin rash. Signs and symptoms occur more in children. Symptoms include abdominal bloating with pain, chronic diarrhea that is foul or smelly, or constipation, vomiting, weight loss, fatigue, irritability or behavioral issues, and even delayed growth and puberty.
How celiac disease is diagnosed. The three ways that celiac disease is diagnosed is either by a blood test, a small bowel biopsy, and by being put on a gluten-free diet and recovering from symptoms caused by celiac disease. Celiac disease is most commonly diagnosed by a variety of blood tests that test for a presence of a genetic marking of the disease or to test for antibodies of gluten. The best way to diagnose celiac disease from the three ways is by a small bowel biopsy, also known as the golden standard for diagnosis. With a small bowel biopsy, when diagnosed a patient with celiac disease, the doctor looks for atrophy of the intestinal vial. As the vial has become flattened so that there is less surface area for nutrients to be absorbed. For a person with undiagnosed celiac disease, the long-term problems and complications of undiagnosed celiac disease is a risk of intestinal cancer, making it important that celiac disease is diagnosed early. Celiac disease is often underdiagnosed, which in some countries, school-age children are screened to help diagnose celiac disease.
Having to make changes with your diet and being strict with what you eat is not easy, especially living with celiac disease. It can be extremely painful and extremely debilitating with everyday tasks. It is important that an understanding of therapeutic measures and pharmacological approaches to the disease are met to avoid constant discomfort, as inflammation from the disease can become severe. Having a 100% gluten-free diet is going to be the only thing that will truly help the disease be at ease. Celiac is an autoimmune disease, so every time you're putting gluten into your body, it's having a reaction with your small intestine and making it hard to get those nutrients you need, as well as it's going to cause a lot of pain. By avoiding gluten, you will stop this reaction from happening in your body. Especially in children and adolescents, celiac can be pretty severe, as it can cause malnutrition because those nutrients are not being absorbed. Additional vitamins and supplements may be needed to be taken to ensure that they're getting everything their body needs to grow. When celiac is more severe, corticosteroids may be taken to help with inflammation. This is to help the intestine heal and ease the discomfort while everything's healing on the inside. Corticosteroids work by suppressing inflammatory genes that flare up with chronic inflammatory diseases. Other drugs such as atrazepam, azazan, and Imuran, or budesonide may be taken as well. Overall, it is super important that if you think you have a gluten intolerance, you talk to your doctor, as celiac disease is damaging to your small intestine and is extremely painful if untreated.
Nursing priorities and interventions. What can you as the nurse do to help a patient with celiac disease? You can start by creating a nursing care plan. You can use your knowledge of nursing diagnosis and desired outcomes to offer quality care. Some examples of nursing interventions include ensuring the patient has a gluten-free diet and has a good understanding of what they should and should not ingest. Education plays a vital role in maintaining celiac disease. You can help them create a food, fluid, and weight chart. You can refer the patient to a dietitian who will provide a more specialized care. You can use a standardized stool assessment tool, such as the Bristol stool chart, to monitor the patient's bowel pattern. You can administer medication, vitamin supplements, and minerals as prescribed. Steroids, antidiarrheals, and antispasmodics may be used to treat intestinal inflammation and help with symptoms. Encourage the patient to increase fluid intake to ensure they will not have dehydration due to severe diarrhea. Cold drinks can increase intestinal motility. For severe diarrhea, you can also start the patient on a nothing by mouth status. This can help rest the bowel by decreasing peristalsis. As recommended by the dietitian, a gradual progression from NPO to low fat to low fiber to a full gluten-free diet can help manage celiac disease symptoms.